Living healthy with COPD. Exercise and COPD. Seated aerobics. Improve your circulation and help the body better use oxygen. Improve your COPD symptoms. Build energy levels so you can do more activities without becoming tired or short of breath. Strengthen your heart and cardiovascular system. Increase endurance. Lower blood pressure. Chair aerobics, a series of seated, repetitive movements, will raise your heart rate and help you burn calories, as will many strength training exercises when performed at a fast pace with a high number of repetitions. In fact, any rapid, repetitive movements offer aerobic benefits and can also help loosen stiff joints. Exercise and COPD. Strength training. Strength training can promote muscle growth and strengthening in normal subjects, and may therefore represent a useful addition to whole-body aerobic training in patients with COPD. In addition to improving peripheral muscle function, this training modality may enhance exercise tolerance in patients with COPD. Exercise and COPD. Exercise can be difficult for patients with COPD, but since it is so vital to maintaining overall health, COPD patients need a way to incorporate exercise into their lives. Yoga. The controlled breathing in yoga can ease anxiety, achieve relaxation, and provide more oxygen to the bloodstream. The exercises help open blocked airways caused by bronchitis or emphysema, which are linked to COPD, and can improve the function of air circulation. Simple yoga moves can even aid those with advanced COPD. Patients with COPD are at high risk for depression and anxiety. Yoga techniques are suited for promoting relaxation, psycho-emotional stability, and exercise tolerance. It was concluded that yoga breathing exercises improve diffusion capacity. They are beneficial to COPD patients, and they can be used as an adjunct therapy with the conventional medical therapy. Exercise and COPD. Walking can relieve depression. Physical activity is an excellent antidote for depression thanks to the release of endorphins, brain chemicals that have a calming effect on the body. It can help you kick the habit. Regular activity can also help you avoid a common side effect of quitting smoking, weight gain. So if you've been putting off ditching the habit for fear you'll put on the pounds, that'll make it even harder to breathe. Keep in mind that by walking you can deal with two health issues at once. Lower blood pressure. Walking can go a long way toward bringing blood pressure levels down to normal, according to the American Heart Association. In fact, walking is as effective as running for lowering blood pressure. To get this effect, the American Heart Association advises walking for an average of 40 minutes at a moderate to vigorous pace just 3 to 4 times a week. Reduce stress and anxiety. Walking can reduce stress by helping to metabolize stress chemicals and also by bringing about the release of endorphins, brain chemicals that lower pain and lead to an overall feeling of well-being. Exercise and COPD. Tai Chi. A group of researchers found that Tai Chi, an ancient martial art and form of exercise, could offer a low-cost, easily accessible alternative to pulmonary rehabilitation for patients with chronic obstructive pulmonary disease, COPD. Michael Polke, PhD, the study's first author, added, "Physical activity is key to reducing symptoms in COPD. We do recommend pulmonary rehab, but our studies show that Tai Chi is a viable alternative when there is no local pulmonary rehab service. We encourage PR providers to consider Tai Chi as an alternative therapy that patients would then be able to continue unsupervised in their own home. Exercise and COPD. Seated aerobics. Improve your circulation and help the body better use oxygen. Improve your COPD symptoms. Build energy levels so you can do more activities without becoming tired or short of breath. Strengthen your heart and cardiovascular system. Increase endurance. Lower blood pressure. Chair aerobics, a series of seated, repetitive movements, will raise your heart rate and help you burn calories, as will many strength training exercise when performed at a fast pace with a high number of repetitions. In fact, any rapid, repetitive movements offer aerobic benefits and can also help loosen stiff joints. Exercise and COPD. Swimming. The diagnosis of a debilitating lung disease like COPD comes along with a plethora of advice. Eat this, not that, be aware of air pollutants in your home, exercise your lungs. When it comes to swimming with COPD, it's important to know if this particular exercise is right for you. Positives. Good for beginners. If you're trying to get yourself moving for the first time in a while, swimming can be great as it's a non-intensive exercise. Easy on the joints. Years of walking and standing lead to your knees becoming battered and weak. Exercising in the pool, especially water aerobics, makes a great alternative to other joint stressful activities. Great for your heart. Suffering from a lung disease often goes hand in hand with excessive strain on your heart. The lack of oxygen on your blood forces your heart to work overtime, pumping more blood to make up for the low oxygen level. Low resistance exercises that are completed over long periods of time, like swimming, give the heart a great workout. However, watch out for chemically induced flare-ups. While the smell of chlorine may signal pleasant images in our brains of summertime and fun with our friends, it could also signal a flare-up of COPD symptoms for those that suffer from the lung disease. The chemicals can irritate the airways and induce coughing and wheezing. Try to avoid indoor pools and spas, as the air is more saturated with chemical fumes than pools that are outdoors. It is easy to overdo it. It seems contradictory that the concept of swimming is good for beginners, but it is an exercise that can go from relaxing to excessive quickly. When you swim, you use your entire body, so your heart and lungs need to work fairly hard. Keep your exercise simple and build up over time. Also, watch out for the heat. Unfortunately, the best and oftentimes the only time of year to use an outdoor swimming pool is during the summer. Managing the heat with lung disease can be difficult and stressful. To combat this, drink plenty of water and watch the weather report. On really hot days, opt for an indoor exercise instead.